Mr. Reed, this question starts with you. One of the most important industries in this district is agriculture. How do you see yourself promoting various agricultural interests, starting with the dairy industry?
You're absolutely right. Agriculture, we've been meeting with so many Farm Bureau representatives, individual farmers as we go on the trail. Agriculture is the #1 industry in the state of New York. You know, when Wall Street was struggling, you heard how that became a priority of the nation and everybody was running to aid it and bail it out, which we adamantly opposed. And no one's really talking about the crisis in agriculture at the same level. It needs to be put on the table and spotlighted, and that's what we're going to do. You know, when we talk about the dairy industry, you have archaic pricing orders that are in place that are based on factors from Wisconsin and Chicago on the futures market that don't take into consideration local impacts and local issues that really impact what the price level should be. So that needs to be adjusted and taken into consideration. You know, I fundamentally also agree with the concept that many farmers express to me is essentially, you know, they look at their land as a sacred piece of their livelihood. And to me, when they say that essentially leave them alone in order to attend to their way of life, that resonates with me. Because I don't know a farmer who is in the business of destroying their own land. And so when you get, you know, farm labor bills, when you get EPA regulations where there's proposed talk about a mile buffer in certain areas across rivers and watershed areas, that's not taken into consideration what those farmers are doing. Those farmers are responsibly engaging in their industry, and what is coming down the pipeline is big government from Washington, D.C. trying to regulate that industry out of existence. I recognize that it's a way of life, and we're going to stand for solutions that are going to allow it to be passed off for generations to come.
Mr. Zeller.
Again, another wonderfully political answer, short on details. Here's what I think ought to have happen. First off, we have to acknowledge that in our district, clean energy is yet another area where we can do something good for our farmers. Our current agricultural output for this district is about $500 million. Now in Steuben County alone, there are 80,000 acres of dormant farmland that if we were to grow something called switchgrass on, could be used to make a cellulose-based ethanol. And in Steuben County alone, that industry, starting today, would be worth anywhere from $2 to $3 billion. We could increase the value of our lands sixfold in 1 year simply by having some type of subsidization going towards the development of switchgrass in the same way that we currently do with corn. Moving forward, I think we need to ease the good agricultural practices for our smaller farms. As it's currently stipulated, farmers have a difficulty, if they're a small family-sized farm, being able to meet the stringent requirements that are set up by the Department of Agriculture to be certified as a good agricultural practices farm. It would help tremendously if we could then tie that recipient and easing of the process to be certified as such to allow people to sell milk directly to our public schools and put incentives for public schools to buy local. We need crop insurance. We need to end and protect, I should say, end illegal imports. We've got a lot of illegal imports, including our organics that are coming in. We need incentives for schools to buy locally produced food and dairy. I think we should bolster the dairy export incentive program. And I think we should continue the milk income loss contract, which has worked phenomenally well in the past year and prevented the local dairy industry from really going sour once the price of milk went down about $12 per hundredweight. All this is saying that is I've done the homework and I actually have some solutions to this. We need to acknowledge that when we have leaders up here, you have a genuine choice. You can get a bumper sticker solution, or you can actually get somebody who's gone out and learned these issues.
Thank you. The proposed completion of the Route 219 expressway to Cattaraugus County in western New York is an important transportation issue. The state has recently withdrawn funding for the environmental studies needed before the route can be extended. How would you promote this important corridor in Congress?
One of the big things about the Route 219 is it goes through the Seneca territory, as we all know. And we're going to obviously have to come sort of agreement with the Seneca because under federal treaty law, it is their land and they have the right to decide how it's developed. going forward, I would try to bring leaders of the Seneca together along with leaders in Congress and leaders within the road development industry in New York State and say, look, this is something where we can probably find an economic benefit for everybody. But I also understand that there are some watershed issues surrounding some of the wetlands. Now, I don't have all the solutions. I am not the subject matter expert on everything, and this is one area where I'm willing to admit that I'm going to be looking to the folks in my district for their answers and talking with them because I consider them to be the subject matter experts in this. So I'm going to be calling up folks like Rob Porter, who is the chief counsel to the Seneca, and saying, well, what is the Seneca's perspective from this? I'm going to be calling up the New York State Department of Transportation and saying, well, what is the environmental impact study saying as it's currently going forward? And then I'm going to take leaders and innovators, I'm going to sit down together and see if we can't come to some sort of equitable solution.
Yeah, on the Route 219 issue, we're definitely fully supportive of it. We think, I've met with representatives of the nation, met with representatives of the local officials that are advocates for it. And I see the economic opportunity that it could create for our area. It will open up vast areas of Western New York to transport. And to me, that's a role, as I said in the onset, that is a role of the federal government, that it is to invest in its infrastructure. So we support it. We definitely would advocate for that type of expenditure and that type of investment. But I do want to articulate something. What you're seeing here is a philosophical difference between my opponent and I come to the table. My opponent wants to throw out the government can solve all your problems. Let me tell you something. Anybody who tells you that is not being 100% honest with you, because the government cannot solve all your problems. All we can do is make sure that the field is level, that you're enforcing the rules, and ultimately it's going to rely on the individual for their accountability and responsibility to go forward with the issues. And that's the philosophy we bring to the table. So I think you're going to have a choice come November 2nd between those two philosophies. And I fundamentally believe that big government solutions have gotten us into this position, and it's no longer sustainable. And that's the philosophical belief system that we will bring to Washington, D.C.
West Valley in northern Cattaraugus County has been home to radioactive waste since the 1960s. The Department of Energy in New York State have agreed on a two-phased approach to the cleanup of the former nuclear fuel reprocessing plant. But that delays a decision on removing underground tanks and low-level burial grounds. If elected, what would you do to make sure the West Valley demonstration project receives sufficient resources to complete the cleanup?
This is an infrastructure project that we have to make a priority in our district. We had the opportunity and the honor to tour the facility, to tour the project, to look at the canisters that are now on site, and listen for. We spent a whole day there and looked at the storage, the waste sites, and I'm glad to hear that the consent decree has been agreed to, and fundamentally that's addressed a lot of the issues as to who's responsible for what, and we want to be a strong advocate for that. And the operators of the project know that our door is open. We continuously communicate with them, and that's one of the frustrations we've had with the fact that we haven't had a representative for the last 6 to 7 months, because they have been pushed to the bottom of the line. They'll be the first ones to tell you that their voice has not been heard in Washington, D.C. because there's been no voice there. And we'll be a loud voice because that project needs to come to conclusion, and it needs to be wrapped up.
Mr. Zeller?
Yeah, I think this is one area where we don't disagree. We agree on this. It needs to be cleaned up. There's got to be a solution going forward. The lack of representation has definitely put it down to the bottom of the list. The only thing I would add to this is that I would like to make sure, I think Tom would agree, that it's done in the most environmentally safe manner possible, because we're talking about toxic waste.
Name something that you like and something you dislike about the health care reform bill. And would you vote to repeal it knowing it extended coverage and included pre-existing conditions?
There's really 5 things I like about it. You mentioned too, the one that we no longer can have our insurance denied to us based on a pre-existing condition. A cleft lip or a palate is a pre-existing condition. Type 1 diabetes is considered to be a pre-existing condition. You can't have your insurance stripped from you as you're being rolled into the ER after faithfully paying into the system for 30 years. Just to find some actuary in Omaha has decided that when you need a quadruple bypass heart surgery that you suddenly don't qualify. I like the fact that we extended coverage for children up to the age of 26, and I have still yet to find a parent in this district who would not want to see their children have health care. I like the fact that we closed the Medicare donut hole for seniors in the prescription drug program. And I like the fact that, especially for the college students in this room, we finally took banks out of processing federally backed student loans. What I disagree with, adamantly disagree with, is a couple of things. First off, we put 24 million people into a system without ever coming up with how we were going to pay for it. We, for the first time in our nation's history, said that you have to buy a private industry's product. I'm not really sure where in the Constitution it says that. We also never did anything to address cost. What I'd like to see going forward is I'd like to see a system in which, same way with auto insurance, if Geico can save you 15% in your car insurance, it's because they have to compete with State Farm and Progressive across state lines. I think the same should have to hold true for Aetna, Kaiser Permanente, Preferred Care, and all the various other health insurance companies that we have out there. I think there should be national competition with a baseline modicum level of care. I'd like to see an actual discussion, which would have been great if this Congress had been up to the task of it, on how we practice medicine. See, currently we really only become concerned with you when you've developed type 2 diabetes and you need dialysis. We ought to be becoming concerned with you on that path to dialysis. We should be practicing preventative medicine as opposed to defensive medicine. And finally, I think Congress should have mandated that we adopt one system of electronic records. There's currently 7 systems out there. You, the healthcare consumer, are the ones who are paying for that cost. It would be as if Yahoo and Google did not speak to each other via email. That's how our doctor's offices currently operate.
Well, this is definitely something my opponent and I disagree on. I stand for repeal of Obamacare. My opponent will not make that commitment. To me, the fundamental thing with Obamacare that troubles me the most is that it missed the mark at the end of the day. I had a lot of hopes for it when it was first kicked around in the debate forum. They were talking about cost. They were talking about how health care was being delivered in America. But ultimately what happened is it became an insurance mandate and a large insurance reform package. That doesn't do anything to the fundamental issue that we're dealing with in America when it comes to health care. And now we're no longer talking about it because everyone assumes that with Obamacare's passage that there's no need to talk about it. Well, I just saw my premiums go up again, about 12.5% in my businesses, and that's directly related, directly related to the health care cost of what it's costing medical providers, what it's costing doctors, what it's costing those in the industry to provide the service.